This video will cover ordering new medications from the progress note. Prescription orders are placed within the treatment section on the progress note. There are multiple ways to order a new medication. First, you can use the Quick Note button found to the right of the orange treatment link. This will open a quick search window. Prior to searching the drug name, check your filters. Click the funnel icon to the right. I prefer to see all orders, so I select all of the categories. Under RX type, I also like to look at all RX. If you want to narrow the search down, select only the category or the type that applies to the type of order you are searching for. Once you make your selection, click the funnel icon again to close the options and begin typing in the search field by the drug name. This field is a contained search, not a starts with search. A list of assessments is going to appear on the left. Select the assessment you want to prescribe the medication for. To the right, you are going to see all of the matching searched medications. The order type, in this case RX, will be identifiable by the icon to the left of the drug name. RX is for prescriptions. Other orders may appear, such as labs, diagnostic imaging, procedures, or injections. So pay attention to the icon to make sure you're placing the correct order. Also, be careful to select a medication with the green check mark. This indicates the NDC is correctly mapped to the drug. To the right of the medication name, you will also see a star icon. This will allow you to add this drug to your favorite medication list. When it's blue, the medication is already on your favorite list. Check the star if you wish to add additional medications. To add a medication, just click on it. The take directions can then be edited by clicking on the medication in this window. To add the medication to the treatment window without any sigma or directions, use the button on the top right to add without sig. To return to the medication search window, click the white arrow on the top right corner. To use the dosage calculator, click on the red D icon. To edit the sigma and the take directions, click on the pencil icon. From this window, you will then select the strength, the take, the route, the frequency, and the DDR, or duration, dispense, and refill. To clear the last three fields, use the button on the top right, Clear DDR. Then you can make your selection again. Enter the start and stop date in the middle using the fields as seen here. The source will be the provider placing the order. To add the medication to your favorites, along with the strength and all the take directions selected, click Add as Favorite. And click OK to save it. The notes field will not be sent to the pharmacy. You can also access the dosage calculator from here on the upper right-hand corner. Click OK to add this medication to the treatment orders. If any drug interaction warnings exist, a pop-up will appear based on the user's My Settings for the drug severity pop-up check. When a drug interaction warning pops up, you have the option to view all active drugs, which will show you that the interaction check will only be done among all active drugs in the list. Or you can choose to view interactions for new drugs with active drugs. The interaction check will be done among newly started drugs only. After you read through all of the interaction warnings, it is necessary that the provider placing the order take an action and enter any detailed notes here. Click OK and enter your action. Click OK to save your interaction actions. Another way to order a medication is by accessing the orange treatment link found on the progress note. You can also access the treatment window by using the RX icon found in the progress note toolbar. There are many options in this window. You can use the quick order field on the top right, which performs in the same manner as the previous search window I demonstrated. The two buttons to the right of the caret are going to be discussed in a separate lesson on Progress Note shortcuts that will discuss the OS button for order sets and the E button for eClinisense. You can also click the RX link on the top left or click on the Add drop-down menu and select RX. Both options are going to bring you to the Manage Order window, and that will place you on the second tab called Add New RX. This window functions very similarly to the previous quick order window. The assessments are going to be added on the left. You will select the assessment that you wish to order the medication for. On the right side, you will perform a search using the drug name in this field. You can activate your favorite medications by clicking on the star icon found to the right. When it's yellow, you are viewing only your list of favorite medications. When it's white, you are viewing the entire dictionary. Check your filters again using the funnel icon. When you find the medication you wish to add, click on it. This will display a list of available strengths for that particular medication. You can use, again, the dosage calculator, the edit icon to change the strength, take, route, frequency, and DDR. You can also add this medication to your favorites by selecting the star icon found in the third column. Click OK to save it to the favorites. The question mark icon found in the fourth column and the question mark button found next to the funnel icon is the legend for the drug formulary benefits. It will explain the symbol that will appear for the patients in the fourth column of RX eligibility below. If there is a generic equivalent found for this particular medication, you will see the name of the generic equivalent found in this field. For example, Coumadin will have the generic equivalent of warfarin. To select the generic equivalent, click on the blue link, the drug name. This will change your search field to the selected drug. After you select the drug, it's going to appear in the lower part of the window under the selected medicines. This is going to group the medication based on the assessment it is linked to. If you added one in error, use the trash can icon to the right to remove it. Click OK to save it and add it to the patient's treatment orders. This is what the treatment window will now look like. The orders will be grouped by default under the diagnosis code that they are linked to. You can always edit the directions by clicking on the name of the drug. This will open up the detailed screen as we saw previously. The eye icon that is found to the right of the medication details will display the RX education material. On the left, this will show you the available languages, and you can print this for the patient here. Or you can wait until the end of the visit once the progress note is complete to print educational material. This can also be printed using the Education button found in the treatment window. The yield symbol on the right is going to display in red if an NDC is not present. Finally, if you are complete with placing medications and wish to send them right away, you can send them using the Send button directly here, or use the upward arrow to e-prescribe, print, or fax the prescriptions. E-prescribing will be covered in more detail in a separate lesson. Another important factor while adding medications is to check the allergies. The allergies and the interaction buttons are going to display in red if any critical warnings appear. Click on the allergies or the interaction button and take immediate action on those warnings. Let's see what the progress note will look like now. Under the treatment section, we can see our assessment code and we can see our medication with all of the details that were prescribed. That concludes our video on adding medications to the treatment window. Thank you for watching.